Looking back, it had become too labor-intensive scanning all of our medical records. We had increased our number of full-time employees that we thought could accommodate this task. However, it would have doubled in the number of FTEs that we would have needed had we continued.
So Tony, I remember there were several vendors that were involved in the process of selection. Why did you choose us?
Another vendor that we had worked with recommended DISC to us. DISC was a company who had already integrated into our EHR platform. It was a direct link into our EHR. There was no portal link, which was a huge determinant for us to use DISC. DISC allowed us to also customize different tabs in the chart so that it was easy to find various items that we were looking for.
So Tony, one of the things we noticed right away was your willingness to work with us like partners. And that was exciting to us. Many times you see that client-vendor relationship, and going into this as partners was great.
And if you remember, we had many medical records rooms. We ended up converting over 170,000 charts, which was about 15 million images, which is quite unbelievable to most people. By doing this, we increased the care coordination amongst specialties, and it didn't matter what specialty any provider was in, they were able to see everything in the chart. We made the decision to scan the entire medical record during our scanning process. One of the main reasons to do this is due to our multiple medical record locations, we decided that we would be able to repurpose this space and use it for patient and clinical activities.
As we were winding down the historical scanning project, they came to us and they actually had another issue, and the issue was that they were having trouble keeping up with all of the incoming daily documents and really the daily indexing that's required for all those documents that come in and need to go into their EHR. So we collaborated with them and we came up with a solution, and that solution actually has evolved over time. We developed it through 3 phases with them and eventually launched the 3rd phase, which we now call BetterChart.
And BetterChart has been very beneficial for us. DISC is able to index our documents for us every day. One of the great benefits of partnering with DISC is their willingness to collaborate to help us solve any issues we've identified.